Hi, my name is Susana, and my colleagues Sarah, Kaela, and Lauren will be joining me in presenting on Dravet Syndrome. So, what is Dravet Syndrome? Dravet Syndrome, also known as severe myoclonic epilepsy of infancy, is a rare form of intractable epilepsy that begins in infancy and proceeds with accumulating morbidity that significantly impacts individuals throughout their lifetime. There are about 80% of individuals with DS that have the mutation in their SCN1A gene, and about 0.0064% of the U.S. population have DS. Some of the risk factors are mutation in the gene, and that it is caused by extensive brain dysfunction and associated with genetic abnormality, although it is not inherited. Clinical presentation. DS varies by age, but their main symptoms are seizures, developmental delay, cognitive impairment, and motor dysfunction. The earliest you can detect for signs of DS is within first year of a baby's life. A prolonged seizure with a high fever can be the first sign of condition. Myoclonic seizures are also common and is basically jerking of a muscle group or one area of the body. Frequent, prolonged seizures triggered by high temperatures, speech impairment, ataxia, hypotonia, sleep disturbances, and other health problems. Some of the prognosis are sudden unexpected death due to epilepsy. 10 to 20% of individuals with DS die within 10 years of age. Average life expectancy is not well defined. A study showed that seizure and mental prognosis can be improved by preventing seizure occurrences at a young age. For precautions and contraindications, seizure control and management, reduce seizure triggers such as fever, hot temperatures, excitement, and stress, avoid medication-caused sodium channel blockers, and having a seizure action plan. For physical and behavioral symptoms and characteristics, it actually depends on the area and extent of brain damage, but some are difficulty with walking, intellectual disabilities, behavioral and emotional issues, speech and language impairments, prone to infections, feeding problems, sleeping difficulty, seizures, loss of developmental skills, and autistic-like behaviors. And here is a picture of some of the characteristics I've mentioned earlier, including crouched gait.
Symptom presentation varies and progresses throughout the lifespan. In infancy, as defined as birth to 2 years of age, we see occurrence of typical seizure onset between 1 to 18 months, followed by recurrent generalized tonic-clonic seizures. Myoclonic seizures are then typically seen by age 2. As children with DS are seen to develop normally within the early stages of life, a hard diagnosis is often delayed. In childhood, we see the occurrence of more persistent seizures, which include focal and/or generalized convulsive seizures, and in many cases, myoclonic, focal, atypical absence, and tonic seizures. And after age 2, they begin to lose development of critical milestones. Intellectual disability becomes evident by 18 to 16 months of age, and by 3 to 4 years, abnormalities on neurological examination are typically evident. Other characteristics observed in this age group include the development of a crouched gait, hypotonia, incoordination, and impaired dexterity. As children enter the adolescent, young adult years, we see a worsening of gait abnormalities and also a decrease in seizure recurrence. Additionally, hyperthermia as a seizure trigger is seen to become less problematic. There are many medications and medical interventions that can be utilized when addressing symptoms of DS. The primary goal health professionals should focus on is seizure control. Anticonvulsant drugs can be used for seizure reduction in children 2 years and up. Ketogenic diets, which emphasize high-fat, low-carb intake, are a useful nutritional intervention. And CBD can also be used for seizure management. Additionally, having a multidisciplinary team, as well as obtaining an early developmental assessment, are both seen as critical in addressing the impact of DS for the child and their family. Functional implications of DS include limited abilities to participate in ADLs independently, poor coordination, impaired dexterity, loss of developmental milestones, low motor tone, unsteady walking, crouched gait, growth and nutritional problems, as well as problems with the autonomic nervous system. As practicing OTs, there are specific precautions that we need to consider when working with these clients, including seizure triggers such as heat, flashing lights, visual patterns, high temperatures, overexertion, stress, and excitement. It is also important to have an emergency seizure plan. Areas of development that could be impacted are motor and fine motor impairment, cognitive impairment, behavioral changes, which are seen to mimic that of autism and ADHD, such as aggressiveness, irritability, and relational difficulties, as well as neurodevelopmental delay and a language deficit. Let's take a look at some of the primary client factors that the symptoms of DS can impact. It is important to note that due to increasing seizure activity, cognitive implications can and will range from mild to severe. In the category of mental functions, specific higher-level cognitive, attention, memory, and emotional can be affected. Additionally, global psychosocial, temperament, and personality, and sleep are also impacted. Sensory function deficits will include visual, hearing, and vestibular, and neuromusculoskeletal and movement-related functions will include joint mobility, muscle power, tone, and endurance, involuntary movement reactions, control of voluntary movement, and gait patterns. Additional body functions impacted by DS include the cardiovascular system, as individuals may develop arrhythmia, hematological, as seen in iron and vitamin D deficiencies and low platelet counts, immune systems, as they are more prone to chronic infections, allergies, bronchitis, and ear infections, respiratory systems, voice and speech functions, and digestive, metabolic, and endocrine systems as a result of problems with the ANS. Performance skills that are impacted will depend on the area and the extent of brain damage from seizure activity, but will involve motor, processing, and social interaction skill deficits. Individuals with DS may have trouble with align, grip, manipulate, coordinates, walks, flows, and endures. Processing skill deficits may include attends, chooses, initiates, sequences, terminates, and organizes, and they may struggle socially in approaches, concludes, speech production, fluent speech, regulate, looks, transitions, and taking turns. Starting from a very young age, Dravet Syndrome can impair a child from reaching critical developmental milestones, which can directly affect their successful performance in some of their most valued occupations, including basic ADLs, such as bathing, dressing, feeding, sleep participation, academic performance and participation, play exploration and participation, and socializing with peers. As a child takes on the role of a son, daughter, or sibling, they can have strained familial relationships due to their medical needs being prioritized over that of other family members. They may struggle in school activities and fall behind their peers, which can also affect their ability to make and maintain friendships. When considering family dynamics, there is an increase in parental stress and impaired sibling relationships. Family bonding can also be negatively affected by limiting the amount of time that members can spend together due to the high demands that need to be prioritized for the child. Children with DS require strict medication management routines for seizure management. Sleep patterns are disturbed for both the child and the parents/caregivers, and depending on the severity of symptoms, children will require extensive therapy with SPTs, OTs, and PTs, and families may find themselves struggling managing frequent appointments many times in a week or even in a day.
Dravet syndrome falls within the OT scope of practice because OTs aim to maximize the quality of life for this population. As an occupational therapist, they will be able to address an individual's physical, social, and mental well-being through occupation-based interventions that will address their client-centered needs. Children with Dravet syndrome begin to have developmental delays shortly after their first year of life, which impact their ability to participate in their occupation of play, social participation, ADLs and IADLs, health management, sleep, and education. Occupational therapists are able to address all these occupations through evidence-based interventions to improve the child's ability to engage in activities. Interventions such as sensory integration training, functional mobility for fine and gross motor skills, and providing orthopedic interventions such as bracing or splints to support movement and prevent joints from stiffening up. Additionally, OTs are able to collaborate with caregivers to provide caregiver education on caregiving for a child with Dravet syndrome to implement the best quality care in the child's home to support their quality of life. Because children with Dravet syndrome have frequent seizures, cognition is impacted, which causes their motor development to be delayed. Therefore, we chose the motor learning frame of reference to guide our intervention. This frame of reference can focus on functional movement synergies to promote goal-directed functional actions. The therapist will be able to focus on the child's strategy to coordinate movement for solving a task in the most energy-efficient way for the child to participate at an optimal level. Motor learning strategies to improve performance will consider the child's movement capabilities, environmental conditions, and the action goal to complete a task. Providing intrinsic and extrinsic feedback by doing open and closed loop activities can help a child with Dravet syndrome improve performance by providing opportunities for practice. This will ultimately promote independent performance and decision-making, which will then evaluate the motor learning has been acquired, transferred, and generalized. One of the standardized assessments that we chose was the BOT-2. This assessment ranges for individuals between the ages of 4 to 21, and it measures a wide range of fine and gross motor skills. This assessment uses engaging, goal-directed activities, and it is broken up into 2 subtests. The first subtest consists of fine motor skills, which addresses their fine motor precision, their fine motor integration, manual dexterity, and upper limb coordination, and the gross motor subtest consists of their balance, running speed and agility, bilateral coordination, and strength. Many infants with Dravet syndrome don't begin to show developmental delays until they turn 2 to 4 years old, and according to TheraCare, children's development begins to slow down over time due to the increase in seizures throughout the child's life. This assessment has 53 items that will assess the different functional movements performed by the child, and utilizing this assessment will take into consideration the client factors and performance skills to determine the specific areas they have deficits in based on their scores. The other standardized assessment that was chosen was the Miller Function and Participation Scale through performance-based observations and context-based ratings. This assessment is for children between the ages of 2 to 11 years old, and as previously mentioned, children with Dravet syndrome have challenges in participation due to some of the motor impairments they have, their cognitive impairments, certain behavioral changes such as irritability and aggression due to the frequent seizures, which may impact their ability to participate in aspects of daily life. Performance-based observations will measure their fine, visual, and gross motor skills, and as you can see, those are some of the areas of assessment listed, such as the occupational performance, processing speed, reasoning and problem solving, self-efficacy, social relationships, strength, touch, upper extremity function, their vestibular system, vision, and perception. And these are all able to assess 4 aspects of 4 neurological foundations, such as their hand function, postural abilities, executive functioning, and participation, and non-motor visual perception. Context ratings will be completed by the examiner, caregiver, and teacher to gain a better understanding of the child's behavior during the testing, their participation in ADLs and leisure activities within the home, and their participation within the classroom. This will help determine the outcome of a skill and a child's participation in school and at home. Using this assessment can guide the occupational therapist narrow down specific occupations the child is having difficulty with to focus intervention on strengthening skills specific to the child to increase the child's participation.
Intervention approaches for establish and restore could include establishing a therapeutic exercise routine, a sleep routine, and effective coping strategies. Interventions can be used to modify the environment and task by adding protective helmets in pad areas, as well as introduce adaptive equipment and task simplification. For prevention, interventions could include developing a seizure action plan and educating family and caregivers to promote safety and prevent further injury during seizures. These interventions will help address both functional movement and stress management. With positive outcomes and visible progress, the client will be able to build self-esteem and motivation to participate more in occupations. Now we will introduce to you Carla and Sabrina. Carla's son has Dravet syndrome and is meeting with his OT Sabrina. Today, Sabrina is recommending some modifications to Carla's new home to help prevent her son from injuring himself during a seizure. To help describe her new home, Carla brought pictures to show Sabrina. This is a picture of Carla's living room, which is one of her son's favorite places to play. Sabrina recommends that Carla places padding on all sharp corners like the table and to also avoid having any glass tables. It is also important to avoid throw rugs and ensure that the carpet is non-slip. Some other recommendations that cannot be seen in this picture include installing electrical outlet covers, removing potential choking hazards, and bolting large pieces of furniture to the wall. Sabrina also educates Carla on safety equipment to keep her son safe and/or alert her of seizures, such as video monitors, safety gates for stairways, and protective helmet. These modifications and injury prevention strategies will help create a safe environment for Carla's son in their new home. The multidisciplinary team could include neurologist or epileptologist with expertise in Dravet syndrome, epilepsy nurse and a social worker with expertise in neurological disabilities, genetics or genetic counselor, dietitian with ketogenic diet expertise, occupational and speech therapist, and a sleep medicine specialist. For effective treatment, a multidisciplinary team is crucial in addressing comorbidities such as intellectual disability, motor defects and gait issues, language impairment, sleep disorders, and dependence in adulthood. The Dravet Syndrome Foundation Family Network is open to any parent or legal guardian or sibling that is interested in accessing their advocacy services and programs. Although you must apply online and will be part of a Facebook group specified to your region like the West Coast, you will have the opportunity to be a part of a family community and to stay up to date on new advocacy resources, clinical trials, and educational and fundraising events. Here at the Loma Linda University Children's Health Epilepsy Center, they use every possible resource to assess clients' needs and find the best options for treatment. They have a very experienced team and expertise in current treatment options, state-of-the-art surgical procedures, and have access to a complex epilepsy team center. At Children's Health Orange County, they have a comprehensive epilepsy program and is recognized as a Level 4 center by the National Association of Epilepsy Centers, which is the highest rank. CHOC can help in seizure management as well as help families in nutrition, mental health, emotional needs, school assistance, transitioning to adulthood, and more. This concludes our presentation on Dravet syndrome. Thank you for listening.